because I thought she was going to choke.
Right.
And I had to grab the trash can, and she's like, oh my God.
What
and
happened?
I go, so I sat with her for a minute because she's in her 80s. She has a lot of things going on, and they just put her on new liver medication and everything else. So I went and grabbed some waters, and I sat with her for a few minutes, and we were starting to flush it. But, I mean, it was very significant what she produced.
Yeah. So
That's great.
that's an extreme example of what clients could be. But so the reason why we chose Sandy, just to recap for those of us on somebody grab a trash can for Facebook Live, is that Sandy's about to get over a cold. So when clients come in to see me and they're currently experiencing flu-like symptoms, we know from our elemental discussions that the flu takes different forms in different people. So some people may have a cold and wet flu. Some people may have a hot and dry flu. Some people may just be totally depleted and exhausted, so you're going to see a lot of dryness in the feet, indicating dryness and kind of weakness that's developed within the tissues. Other people might go into an inflammatory response. Some people might totally lock down, like Jean was talking about, the achiness in the joints, because everything is literally just locked into place and it's not moving as a defense mechanism. So depending on what we see in the feet, we're going to be talking about that. We'll do a half-hour demo just to make sure that the advanced students get time on the table for their full hour on the newbies. But I just wanted to, like, Sandy is an excellent example, especially since, like, everybody's concerned about the flu thing that's going around. So this is a great way for us to experience firsthand how reflexology will actually push the flu around a body. But again, we're not, like, people ask me all the time, like, if you get an infection, will reflexology help to heal it? No, we are not healers. We are facilitating the body's natural healing process. That's what we do. But what we find in the feet will give us a very true assessment about why the flu has stuck around and where it's lodged. I get clients all the time, they're like, I just can't get rid of this lung stuff, and the feet are telling me markers for chronic sinus infection, which, by the way, she has. If you wanted to come take a look at her nail has gone discolored. So also you can see it a little bit on the right side too. So whenever we see that callousing of the nail starting, that is a clouding and hardening of the sinus area. So right off the bat, without her telling me anything, I would be like, if she was wearing flip-flops, I would be looking at her feet and I'd immediately peg her as impacted sinus.
I don't necessarily feel it. I feel like I don't think that it's draining.
Yeah. So all of that, little things to look for. So when we're doing this session, I'm just going to do a quick half hour. So when we do a half hour session, I'll do it exactly like I would at the Institute. We start solar plexus adrenal, skip hot towels at the beginning, relaxation techniques, spine, toes. I'll do ball the foot because it's very chest lung and I want to feel that area, and then upper lower digestive. Same thing on the other foot, finish with hot towels, solar plexus adrenal, done. Okay.
What about the lymphatics?
No, I wouldn't. At this point, because she's not demonstrating any lymphatic backup, and because she's on the tail end of it, I really want to see, is there something in the gut that's weak? I want to see if there's something directly in the lungs, and I want to check the sinuses. Everything else I'll notice by the relaxation techniques and general observation and palpation. Okay. So just really quick, snappy, dirty. And when clients come in for a half hour, like I think Cody and I talked about this the other day, when clients come in and they only want a half hour because they're kind of kicking the tire and they just want to figure out, like, does this thing work like the internet says it does? You have to feel comfortable with that shortened half-hour session. You have to feel comfortable with that teaser. So even though, of course, I would love an hour to push out all of her funk and to get all of this stuff, like, moving in her system, I know that the body and I are going to have a conversation that will last beyond the session. Yes? But for the time being, I need to be able to palpate what's actually happening in the body through the reflexes and then tell her via assessment feedback what is needed. Does she need to heat up? Does she need to cool down? Does she need to pull that mucus out with some kind of astringent quality, like an Epsom salt bath or a really strong tea? Does she need to actually get up and move around and get that lymphatic circulating and get some of that air into the earth, you know, as we would call it? So all of this, very, very relevant. So that's the intention, is to just do something nice, quick, dirty, feel good, pass her the F out, and then give her the feedback afterwards that really allows her to kind of view our session not just as, you know, Sam's pressing the buttons to make me feel better, but this is a holistic experience, and, you know, the hands-on is just part of the work. Make sense? Okay. So, during the session, there's going to be a lot more of that. A lot more of that.
Get the bucket.
But, get the bucket. But oddly enough, if there isn't, that can be possible too. So when clients come in and we're actually working with them, like for her, she's already starting to cough on the table. She's already, you know, in her, like lying horizontally, somebody who has mucus issues, like it's going to start to move. But at the same time, when the session starts, if it calms down, that might mean that there's restriction present, that the relaxation allowed the portals to open and drain properly. But if it does start to activate and the body starts to go into like a spasmodic response in order to cough up that stuff, that's also really significant. So it's all based on kind of what we're feeling. Right at the beginning, if you all wanted to come around, we can see a lot of lining and dryness already on the soles of the feet. So there's definitely some weakness present. Yes? So we can see all through here, the lining, the whiteness around those lines indicating the dryness. We can see the callousing start to really come forward. We can see, but there is that puffiness in the balls of the feet. Yes? So fluid in the lung space, definitely present. Okay? But it's not bad. It is cold though. Like toes and the feet are warm, but the balls of the feet are cold. Okay? So, done with our first 2 points. We're going to wrap the foot because we don't want to use it, but we do want to keep it like nice and comfy and cozy, especially with the colder weather. Like blankets are your friend. So the fleece, you know, very warming. I would, especially if a client is in a health crisis, ask them, do you want a blanket? Do you want anything bolstered? Do you want the room colder? Like what feels good right now? Yeah. So we'll start with our relaxation techniques. Sloppy Susans.
Which everybody loves.
Military train. Everything's moving good circulation-wise. Her calves are really, really hot, and my hands are really, really cold. So just notice, like, the temperature differences. Like, the balls of her feet are freezing, but her calves are really warm. So circulation is definitely part of the issue, just right off the bat. Her bunion is clicking as I'm doing push-pull. So some chest weakness, another marker for that. See, and you think these relaxation techniques are just something that Sam tells you to do. Like, it's not the case.
So with the bunion being clicking, but there's cold, so there's stagnation, but it's air as well?
So water, air.
Water, air.
Yeah.
Okay, so
So, and we know that right off the bat when she says mucus. Yeah, so mucus is the watery fluid that moistens and protects. But at the same time, in excess, it produces coldness, dampness, heaviness, things like that. Okay. Knuckle roll, and then we go straight into the spinal reflexes. Little gloss right above that heel. Yeah, feel free to come around if you want. Also, I know this sounds weird, but listen to the sound of the cough. Yeah? So that one was deep. Like you heard some stuff come up. Yeah. So at certain points when the client coughs is very significant based on what reflexes you're on. The nature of that cough. It's really, really fascinating to me because there are some clients that come in and they report like no chest lung issues whatsoever. And during the session, like they're hacking up a lung. And it's the body has literally just taken all of those nerve impulses and sucked it right into the chest. There is some low back stuff, like there's a really nice kind of inflamed point right in there, but may or may not be related. Just kind of building the file folder. Now we're on to the toes. Okay, so the toes represent what reflexes?
Sinuses.
Sinuses. What else?
Neck.
Neck. What else?
Pituitary.
Pituitary pineal's in there. The neck muscles. Yep. What else?
Ears and eyes.
Ears and eyes. Mm-hmm. What else?
Your thoughts and opinions.
Thoughts and opinions, mentally and emotionally.
Parathyroid.
Yes. Good call. Thyroid, parathyroid. More in the neck. More in the neck reflexes, but yes. Excellent. Good stuff. Okay. And then the deeper meanings of each of the toes individually are also very significant. So we know that each toe starts that vertical zone. So on our chart, we have horizontal zones and vertical zones. So if I'm noticing one toe that's out of alignment, that's colder, that's hotter, that's more fluid filled, that immediately tells me the lungs are fighting the sinuses. The lower GI is fighting the sinuses. The sciatic nerve is involved with the sinuses. You know, all of that stuff's so significant.
Okay.
So her big toe is very, very stiff. And we got a confirming cough. Triple cough, double cough. Done. So the minute that I touched the big toe, body went into a coughing response. Yes? So indicating, and this is the conversation that I'm having with the body the entire time. The entire time.
Left eye.
Her left eye is starting to water, indicating emotional release. Fabulous. Fabulous. So this is the... Of course, I wouldn't say that in the middle of a session. That would be terrible. Terribly awkward. And the client would definitely, like, we don't want to disrupt their relaxation process, but just like the jumping for joy that occurs internally when you and the body start to, like, really get on the same page. And it's not stopping, which is awesome.
Totally. It
Yes.
feels like it's coming out of my throat.
Yeah. So all of this, really good stuff, but something to consider. And we noticed before the session that that's where the major marker was. So the fact that we're touching the marker and the body is literally like freaking out is awesome.
Now, while you're doing your thumb walking there, you had said you noticed the thumb was, or the big toe was stiff.
Yeah.
Are you noticing any hardness or divots in the big toe?
It's a little puffy, it's a little dry, it's a little hard. Mostly it's deep into the joint. Deep into the joint. Yeah. But again, we're only here for a half hour. So I'm stimulating the points and I'm getting out. Yeah. Now we're moving down into the lungs. Get a nice gloss there, starting to walk up in line with each toe for the ball of the foot. Just really easy lung stuff. Again, that big toe joint, is moving. It's hypermobile. So we know that hypermobility indicates weakness in the reflexes, and that's part of that discussion as well.
I'm feeling like a heat or a warmth in my chest.
Ooh, heat
Which
and
is-
warmth in the chest.
Not in a bad way, but it's there.
Which is what it needs right now.
Yeah, exactly. So the body, am I telling the body to do that? No. The body is taking the response exactly where it's needed. And Jody's absolutely right. We notice water in the chest. There's excess of mucus in the chest. And so the body is telling our client that it's heating stuff up. It's moving stuff around, which is exactly what we want it to do. But if we were to be the dumb reflexologist and say, I'm just going to press the button to fix the issue, we wouldn't be concerned with that, you know? So when we listen and when we take into consideration that feedback and when we're actually having the conversation with the body, you know, that's what makes us different.
She have a lot going on over there.
Yeah.
I can tell.
So when you're on the digestive toes and the digestive part of the ball of the foot, were you noticing anything, any response from her?
No.
Or anything? So it's more really sinusy and upper body, chest. Okay.
So now that we're in the digestive reflexes, we'll kind of see what's happening.
Okay.
Okay. So each time we transition, the body is transitioning with us. It's coughing a little bit.
She has a lot of crunchy, hardness over there.
It's
stuck.
I mean, all of it is kind of stuck. But that's okay. Not something you would tell a client, by the way. Like, just think about Think about what you're feeling and think about what you're noticing and try to make it as plain but as nice as possible. Like, there's a big difference between you're broken and you have some work to do.
Right.
You know, so that idea is very present, especially when they're already feeling like crap. They already have a cold. They're already not feeling good. Like, they don't need you to tell them how bad they feel. Okay, so there's a really nice deep heat in the digestive reflexes that is very refreshing. So lots of good stuff happening in the digestive reflexes. It seems like the dryness in the lining might just be because the body has been fighting this for so long. It's running a little bit low on fuel, but there's no like damage or dysfunction. Have you noticed that the digestive issues have actually calmed down since the flu has been present?
I have. I started juicing like a week after I started, because I got my juicer for Christmas. But and I think that really has made a huge difference for my digestive. So I've been focusing a lot on my digestive since I've been sick to make my gut happier throughout all this.
Okay.
So I think that's been...
So here's where we get into very unique methods of balancing. So the digestive reflexes, although depleted, are not bad. And she's doing a lot of stuff already in the digestive territory that we don't need to tell her to do more in the digestive realm of things. Yes.
Should the juicing be warmer drinks though versus cold drinks?
Could be, but there's a lot of good warmth.
With some
like
ginger or something?
the digestive reflexes aren't cold. But what is cold is chest, lung, and
Right.
sinuses aren't moving.
Right.
So our methods of balancing will need to be very customized to moving and warming the chest, but then also unblocking the sinuses. And I have the perfect thought right off the bat.
What
So
about
Didn't you say
steaming?
peppermint?
exactly. So steaming. Peppermint is too cold.
Okay.
So what I would suggest is the steam pot. So big old crock pot filled with herbs that are warming, like a ginger would be very appropriate. Holiday spices, would be excellent.
Like chai.
Yeah, chai. If you literally just wanted to take some chai, some tea, and throw it in a big old pot, because tea has astringent qualities, it'll pull out that moisture, and literally just throw a towel over your head and get as much of that steam in as possible. And just keep it on the stove, keep it boiling, let all of the oils come out, and just like every 15 minutes, like throw yourself in and then pull yourself out, like hot cold it to get things moving. That would be so appropriate.
That's
So
what I made
good.
this morning. I have dirty chai in my cup. So I must have known.
There you
I
go.
knew.
Yeah, so the body knew. I mean, it was already telling her what to do. We just need to make sure that she's incorporating something that's based on the reflexes. So the digestive reflexes are fine. She doesn't need to be nourished. She needs something directly input into those areas, and that's where the steam would come in.
So you don't walk horizontal zone 5?
How about drinking fluid?
Fluids we have to be careful with because she's already super watery.
Would be pushing out fluids, like I know once you mentioned caffeine or that kind of thing when
Yeah,
someone's watery.
Like a good hot cup of coffee would be excellent. Yeah, but the problem is, like, if you were to drink like half a pot of coffee, that might be excess.
We don't want me on that.
So that idea of literally balancing the elements that we find. So even though we're doing a steam pot and the steam is technically watery and vaporous, it's not like we're asking her to drink something, which may compound the fluid. Yeah. Exactly.
So being that there's water and air, you have to be careful as to how much fire you add and heat, because I mean, obviously the deeper element would be the water, and then the air markers come after. So
Well, so here's like
because you don't want to fuel with
that's-
the air and fire. So like
that's a good line of thinking. So the restriction, the earth is in her sinuses. Yes. We need to pull that down into the other systems. So the way that we do that is by breaking it up with air and moving it around so that that density can then be redistributed. Okay? So the way that we do that is by not touching the other areas and just going to the area that is the most congested, the most present, and ignoring all of the secondary symptoms.
Which is the air.
Yeah, which is the air.
Right.
Because the air is not relevant. The heat is present, but it's not present enough where she's in an inflammatory response. The water is present, but it's not like mucky and congested. It's just kind of there. But what is very stiff is the toes.
Mm-hmm.
Now, would that be earth if it's stiff? No.
Yeah.
Okay.
Mhm.
Sam, you just got a Pokemon notification on your phone.
Thank you. I appreciate that.
Now we know.
For those of you who
Master
don't
loves
know,
Pokemon.
I am such a nerd. Such a nerd.
Pokemon Go.
Yeah. Well, so when that still is like my favorite, like when, like I'm writing a frickin' pathology book and I spent like all Thursday talking about nothing but kidney stones. And so like finding the mindless cartoon is my mind's way of like, yeah,
Gotta
letting that
balance
go.
it, yeah.
So that's just,
Your
that's
restored
my method of
restoration.
balancing.
Just don't wander into traffic.
Yeah, right. Not
I
like
got a
with
station
those.
right next to my office at work.
Yeah,
If I walk outside, I get
we have a gym and
the gym.
a gym and a hotspot right. Like I don't even have to leave the shop.
Nice.
Just sit right there in the shop and keep the gym.
I gotta get it on my new. I haven't done it. Right now, it's inspired to do it.
So how come it is that you don't want to walk horizontal zone 5?
Because I'm already hitting it with the heel
You're not going-
rotation.
Okay, all right.
Yeah. And again, like half-hour session is dirty. It's not meant to be thorough. It's meant to just get in, get out.
Well, I appreciate that because that would help a lot when you're doing, you know, if you want to incorporate it to a regular massage.
Yeah.
People would allow me to do that. So we're saying, hey, you really want a whole session of reflexology.
Well, and this idea that if you wanted to substitute other areas, you totally could. But the format that I'm giving you for the half hour, I normally wouldn't work horizontal zone 2 during like a regular half hour. So it just depends on what the person is coming in for. But you just have to be like have a canned routine for your clients that just want the teaser or just want to add it on or something like that.
Oh, my hands are warming up.
Hands are warming up. Excellent. So we have another warming response, which is fabulous.
So I understand she doesn't have a lot of collection in lymphatic portion, but you're moving fluid, so you wouldn't want to do like a lymphatic pump with the dorsal, walking the dorsal valley.
What I would look for if lymphatic was truly an issue would be swelling. Swelling on the dorsal surface, which is not present. Does that make sense?
Yeah, no, it does. I just didn't know since, you know, sensations and fluids and the warmth is moving. I didn't know if that was something that you'd want to do with it.
Again, like in an hour session?
Yeah, I get it.
Totally.
Yeah, I get it.
Yeah, that's the difference between the time dynamic. And we got a facial itch. Excellent.
You're on her big toe right now?
Yeah.
She coughed, yeah.
Yeah, so
Oh,
she
yeah,
coughed,
yeah.
she itched horizontal zone 1, like all good stuff. And another. Same place. I love it. Oh, and the opposite side. So we're getting so many facial itches, which is one of our top 4.
And your eyes are watering too.
Yeah, so
Oh,
we had the
yeah, I
eyes
forgot about
watering. Anybody else? So we have facial itching. What are the 3 other major signs that the body is receiving the work?
Breathing sign.
Breathing changes.
Which is
Twitches, muscle twitches.
Stomach gurgling.
Stomach gurgling.
And Sam, we have a viewer, Lucy Mather from the UK.
Oh, hey, Lucy.
She says, I've been full of cold myself recently, and now I have a chesty cough. Any tips on self-treatment?
So that is exactly what we're working on right now. Self-treatment, if you wanted to utilize reflexology, then I would... Okay, I'm about to get into a rant. Somebody triggered this the other day on some group, and they were like, if I have XYZ disease, what reflexes do I press in order to self-care? And I literally responded, hashtag the whole foot.
Yeah.
And it was, I get so mad with these reflexologists that think that it is just about pressing the buttons. It's totally not. So if you're going to do self-care, Lucy, do the entire foot. Hands, face, ears, whatever extremity you've been trained on, and press everything. Because you're looking for those areas that are out of balance, and you'll only find them if you work everything. But as a general rule, if you're cold, if you're retaining fluid, that's what we would call an infection of water. So you need to counterbalance that with heating activities. Warm food, nourishing soups, preferably on the spicy side, as well as things like little movement, things that preferably get you to sweat a little bit, whether that's wrapping yourself in 1,000 blankets, or just making sure that you're not physically cold at any time, but also hot teas, hot coffee, like anything that's literally going to warm you up.
So a sauna would be okay?
As long as it's not vigorous.
Okay.
Yeah, so if we wanted to do, like, if I were treating it from a yoga therapy standpoint, it would be this idea that I would definitely want to do Bhastrika as opposed to, like, vigorous asana. So Bhastrika is that bellows breath, that heat, that warming breath. Not necessarily, again, not as vigorous as Kapalabhati, but this
Right.
idea that we're stimulating heat and energy. Static poses that are very, very powerful and warming, like a warrior 2 would be very appropriate. Headstand would be very appropriate, although super advanced and not for the faint of heart, literally. So it's just about incorporating that idea of heat. But, far be it from me, you don't know a client's toolkit. So whatever they feel is necessary, and it's about compliance as well. Like, if I tell you to go drink a cup of tea, but you hate tea with a fiery passion, you're not going to do it, and that defeats the purpose.
But you give them the general goals and the principles that they should strive for and let them fill in the blanks.
Exactly. Unless something is really specific, and then you're like, this is what needs to happen in some way, shape, or form. Does that sound good to you? And the client, agrees. Okay. So now we're in the stomach reflexes. We're getting into more digestive territory. But this is pretty much it. Like, we're in stomach now. We're getting a lot of good, subtler movement, even though Sandy hasn't said anything because she's kind of enjoying the wave. And then we're wrapping up with relaxation techniques and hot towels and solar plexus adrenal. Like, that's the session.
Coughing less with left foot.
Yes. Good observation.
And she's getting over it too, so.
Hmm. And you
Sure.
can just, like, for those of you that are watching the Facebook Live, you can't see this, but she's settling. Like, you can see her body is more relaxed.
Yeah, she looks very serene compared to the beginning.
Yes.
And Lucy says thank you, and that in her reflexology, she likes to incorporate the whole foot. So
Excellent. Perfect. Cough with lower digestive. Which, just to give you insight into my thought process real quick. So coughing with lower digestive, but I'm literally on the descending colon reflex. So anything that she does, like back to that idea of the cup of coffee, like as a literal diuretic that will help her poop, that is very appropriate based on what just happened. Like, she had a reaction at descending colon, so there might be some backed up stool that needs to be released as well. So the coffee would do that as well. I mean, just like thinking about it like that. When you're in the middle of a session, when does the body respond? What does that mean? How does that connect? Back to the online course, that, the A&P connections. How do things connect with each other? That whole conversation.
I noticed the waves, the lines were more significant in the right foot
Yeah.
than in the left.
Which is part of that. Like, she's getting over
Right,
it.
exactly.
And I is the last few days I started making sure I'm walking more, which is kind of my thing, and that has helped push this out. So would you recommend that, to more movement at the end of something like this, for someone to do more aerobic or motion?
No, I think the walking is fine. What I would suggest, and this will also give you guys an interesting idea as far as like my thought process. Walk when the sun is out, and it literally warms you up.
Yeah.
Like, especially since it's cold outside and water clings to cold, we don't want you to like be cold in any way, shape, or form. So walking midday, walking in an area that has no shade whatsoever, where the sun is literally warming you up, that you're super bundled and that.
Oh, I definitely can feel like a lizard. I just want to like go out in the sun and just bake.
Exactly. So follow that impulse. And again, like, do you hear what she just said? Like, her body was telling her to do that. Yeah. So we're just the echo of that process. That's all it is. Her calves have actually cooled down slightly.
Stuff's moving.
Yeah. So we're definitely we got some good stuff happening.
That's not how.
Yeah. If you could grab me one dry and one hot, or 2 hot and 1 dry.
Yeah, you're short on the dry towels.
Yeah. I'll get more this afternoon. Yes, mucus.
I feel like I'm getting like 1 cough instead of like 3 or 4 now, which is nice.
Okay. Perfect. So that's good. And hot towels. Slap those right on because they're not too hot. Press. Especially since she's dealing with cold. Press that heat. Ask her body, like, give that warmth. Clear passage. When we talked about this idea of extrasensory perception in the nervous system lesson, I think, no, the sensory system, we did extrasensory perception. It would be totally awesome for you to, as you wrap hot towels, imagine that heat going into her sinuses. Yeah, just with that like subtle intention of this is where I'm pushing it.
I had a CE this past week with a guy who was saying that when the client walks in, you want to immediately imagine them at the end of their session all relaxed and balanced, and visualize that through the whole session, the outcome of relaxed and balanced.
Couple more comments, Sam. Holly Jackson says, "Thank you for speaking
Hey,
your
Holly.
thought process." And then Carrie says, "You're so amazing."
Oh, Carrie. Carrie is terribly biased.
I have a question.
Mm-hmm.
So the next time that she would come in for a session, should you see a change in the nail discoloration on
Yes.
that big toe?
Totally. That's one of the major things that I would look for. And she, like, as a proud client, she would probably be the first person to say that. But things like that, especially like what Jody was sharing this morning, like when you have a marker that's so visible, when it changes, like that's your proof right there. Like that's your way of telling the client, hey, you remember when that popped up? And you remember how it coincided with this issue? And you know how that issue went away? And then that thing went away too? Like that was your body doing that, you know? That kind of stuff. Okay, so end with solar plexus and adrenal. And then we are done. And then we'll get some feedback from Sandy afterwards. 18, 19, 20, 21, 20, like that's counting to 30.
Lucy asks, are the towels just dry and warm, or are they steamed warm towels?
They are steamed warm. So we have a hot towel cabinet that heats the towels. We wet them first, so they're soaked and then wrung out. So they are kind of not, they're moist but not dripping, would be the best way to say it. And then the cabinet does all the work, and it keeps the towels, I think, at like 130 degrees. And then we take them out. Normally they're a lot hotter, and you would see the steam. But that's how we make the hot towels. There's a video on it on our YouTube channel. Perfect. Excellent. How you feeling, my dear?
Thank you. Better.
Better.
Better. Less coffee.
Less
Coughing. More coffee. I don't usually drink coffee, and I had a little bit of my chai tea this morning, so that was cool. It was interesting feeling the hands warm up a little bit, because they were mimicking the toes. So when you were saying that, I noticed that my fingers were cold from here up.
Yeah.
And so that, as they warmed up, that was really, really neat. I mean, I did get a little tummy gurgle, but amongst everything else, I didn't get to fit that in.
So you felt at that moment that it was horizontal zone 1 that was cold?
It was 1 and 2, really. It was just like, up the, So
Awesome.
horizontal 1 and 2, and then I felt more in the right, which was interesting, warm up, than the left. The left did warm up too.
Okay.
So it was interesting that the left, and I haven't been necessarily feeling sinus, but it's draining from somewhere, because it's been hanging on for weeks, where the cough just doesn't want to get out of there.
Yeah.
So that's been like really interesting. But yeah, it was neat, because as it subsided, I didn't think it would, honestly, because it's been going on for so long.
Yeah.
But and then seeing the cough go less as we got into the left side.
Yeah.
I could still feel it in the throat, obviously. But the warmth was really interesting in the chest too, because it was like almost a burning warmth, but was good.
Yeah.
Just kind of like the cough is good, because I feel like it's getting it out of there. So it'll be interesting to see how it goes.
Excellent. So
Sandy, you shared your news that you said you've been holding on to for so long.
Oh yeah. That's
when
true,
did
too.
the news actually?
Oh shoot, what did she tell me? Actually, we've had some other stuff going on.
Okay.
But yeah, I had a dear friend of mine that's been fighting Parkinson's for many years. He's in hospice. And so when I told my daughter, she called me up and goes, and I think, I want to say, well, I haven't been, I'm kind of holding it in because of the actual wedding date. But, so yeah, that's been something
that's
I'm starting to
passed.
tell people.
Yeah.
What the
And
date.
right side is passed, and you
Oh,
said
yeah,
you've been
yeah.
waiting 6 years for this to happen.
Almost, yeah. But yeah, we've been waiting for a while for the engagement. So so that's true. That's a good point.
So
'Cause,
at the end of feedback, we'll wrap up, because I'm sure that we need to take a break, and then we'll switch for the advanced students to get to work. After asking the client kind of what they felt during the session, and explaining and educating, like, this is what that meant, this is what that meant, do you understand that, blah, 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 just kind of talking them through what actually occurred. The last thing that I'll do is drive home methods of balancing. So again, the suggestion was the steam pot, warming herbs. If you literally wanted to take chai tea, throw it in a big pot, towel over the head, inhale just for a couple minutes, let it keep boiling, do something, go back to it multiple times until you feel like that stuff starts to break up. So that's the kind of stuff that I would do towards the end of a session, just to make sure that the client understands this is not the end of what we did here. Yeah? Okay. Cool. Any other questions, comments, concerns? No? Anything?
Cool.
Okay. Cool. So thank you
Feel
all
less
for
down.
watching Facebook Live, and feel free to cut it, and we are all good. So we'll take a quick break, and then advanced students will get to work.